This is Tanya Stansel with Health Education Services. We will be discussing congestive heart failure. First, a disclaimer. This video is solely for educational purposes. It is not meant to treat or diagnose any condition. Congestive heart failure occurs when the heart is unable to pump adequately enough to meet the needs of the body. There are several conditions that may result in congestive heart failure, including coronary artery disease, high blood pressure, long term alcohol abuse, heart valve disorders, heart attack, and cardiomyopathy. There are approximately 6 million people in the United States affected by congestive heart failure, and approximately 670,000 people are diagnosed each year. Among individuals 65 and older, congestive heart failure is the leading cause of hospitalization. Because a heart is weakened by congestive heart failure, its pumping ability is also weakened and moves blood throughout the body slower, which is a decreased cardiac output, and increases the pressure within the heart. As a result, decreased amounts of oxygen and nutrients reach the body. With the increase in pressure within the heart, its chambers are stretched and may become stiff and thickened. The stiff, thickened heart muscle is less able to pump blood. Ejection fraction is the measurement of how effective the heart is pumping. Normal ejection fractions are above or equal to 50%. Congestive heart failure can occur in the left, right, or both sides of the heart, but usually starts in the left side of the heart. Types of congestive heart failure include systolic dysfunction, which is where the heart does not create enough force to pump oxygen rich blood through the body, or diastolic dysfunction, where the heart is able to contract. However, because the ventricles do not properly relax, less blood is able to enter the heart. As the heart muscle becomes weakened, stiff, and thickened, its pumping effectiveness decreases. As efficiency decreases, kidneys begin to retain fluid and salt. The fluid building up in extremities such as the arms, legs, and feet, lungs, and organs causes the body to become congested. Symptoms of congestive heart failure include fluid retention, dizziness, fatigue, weakness, rapid or irregular heartbeats, diminished exercise capacity. Shortness of breath is the hallmark symptom and can occur at rest, with activity, laying flat, or can wake an individual up during sleep. Risk factors include high blood pressure, coronary artery disease, heart attacks, diabetes, some diabetic medications, other medications, sleep apnea, congenital heart defects, valvular heart disorders, viruses, age, alcohol use, tobacco use, obesity, and irregular heartbeats. Tests, in addition to physical exam, can be performed to help diagnose congestive heart failure. Tests such as cardiac blood tests, chest x ray, electrocardiogram, echocardiogram, stress tests, cardiac CT scan, MRI, coronary angiogram, and myocardial biopsy may all assist in diagnosis. Once congestive heart failure has been diagnosed, the stage can be determined. According to the American Heart Association and the American College of Cardiology, stages range from A to D and are based on symptoms present and treatments needed. According to the New York Heart Association, stages range from 1 to 4 and are based on symptoms and the level of shortness of breath. Once diagnosed with congestive heart failure, there are times when you should contact your primary clinician, including if your symptoms worsen suddenly, you have a new symptom, or you gain 5 or more pounds within a few days. These can implicate that congestive heart failure is worsening or the current treatment is not appropriate. Complications of congestive heart failure may include kidney damage or failure due to reduced blood flow to the kidneys, other heart problems due to changes in heart size and/or function, liver damage due to fluid buildup in the liver, or sudden cardiac death due to irregular heart rhythm. Treatments for congestive heart failure include medications such as ACE inhibitors, angiotensin II receptor blockers, beta blockers, diuretics, aldosterone antagonists, inotropes, digoxin, or surgeries and medical devices such as coronary bypass surgery, heart valve repair or replacement, implantable cardioverter defibrillators, cardiac resynchronization therapy, biventricular pacing, ventricular assist devices, or heart transplant. Lifestyle changes that can improve congestive heart failure are improving blood pressure, monitoring weight and swelling, monitor fluid intake and output, limiting salt, losing weight, and monitoring symptoms. Eating a healthy diet, exercising, and obtaining vaccines to prevent respiratory infections can also improve living with congestive heart failure. Thank you for watching our video. Please subscribe below and visit our blog at healthylivingforyourself.blogspot.com.